Students in year 12 and year 13 have an incredibly hard time getting accepted into dentistry and medicine here in the UK. And that's why today Sammy came in to discuss his daughter's dentistry application and what he needs to do to maximize her chance of getting an offer at her dream medical or dental university. I'm John, the founder of Study Smart UK, where our program has an 8 in 10 acceptance rate compared to the national average of 1 in 10 students. And I'm spending the entire day solving Sammy's university problem. Sammy, thanks for joining me today. Looking forward to this. Tell me, how can I help?
So I have a daughter, Sara, who's in year 12. She's a really bright student.
Yeah.
And I'm really hoping she makes the choice that aligns with her dreams and where she wants to go.
Yeah.
Currently, she wants to go down the route of dentistry. So that's why I'm here.
Cool. Is she 100% set on dentistry, or is she considering medicine as an option as well?
She's a little bit in between both at the moment.
Okay, cool. And how comes she's considering both courses? What does she like about each of them?
I have a feeling she's always wanted to be a dentist,
Yeah.
but she's weighing her options.
Okay.
She's not sure if she's going to get in,
Okay.
and that's the reason why the other options like a backup.
Okay, fine. So let me quickly just run you through what the difference is between both. So if we compare dentistry to medicine, to give you some reassurance, when I was in Sara's position in year 12, I was the same. I was really on the fence between dentistry and medicine. Up until about year 12, I really wanted to do medicine. But then I just started to learn more about sort of what the difference is. So they're both 5 years, so we can go through that. So both of them are 5-year degree. With medicine, it's worth mentioning that there's more intercalation available. So have you heard of intercalation before? No. So intercalation is when you do like an extra 1 year, and this is when you sort of specialize in one other master's in science or other degree. So normally with medicine, it's 5 years, but sometimes it can be 6 years. Dentistry is almost always 5 years. So that's one thing. The other thing to mention is sort of what happens when you're actually on the degree. So from experience, I can tell you dentistry, I'm sure you might know this already, but it's much more practical and hands-on. So you're going to be working with your hands, pretty much 5 days a week, and you're going to have patients much more earlier. Medicine is more theory-based. So you won't really get patients until maybe your 4th year, maybe your 5th year. In here, you're going to have patients from sort of 2nd year onwards. In my case, 2nd year. Some universities like Plymouth can be as early as 1st year. So that's the main differences there. On top of that, we have the competition. Do you know which one of these two is more competitive?
I would imagine medicine.
It's actually the opposite. So maybe like other countries it's medicine, but in the UK, dentistry is more competitive. There's only 14 universities that Sara can apply to. For medicine, there's 50 plus. So this is why it's more competitive. Of course, there's a lot more medicine applicants, that's true. So for medicine, I'd say it's about 30,000 applications, and in dentistry is about 10,000 applications. But with this, there's just, so much.
The ratio still...
Exactly, yeah. So the ratio cancels out. So these are the factors to consider. In terms of this, what do you think Sara would prefer more? The practical element, theory element? From what you've seen from her A-level so far, what do you think she'd prefer?
I have a feeling, just knowing her, she'll probably go for something more practical. She's always been a person who likes hands-on.
Fine. So dentistry would make more sense in that case. But what we can also do is on UCAS, you get 5 choices. So what we can do is we can pick 4 for dentistry and then put 1 medicine choice. The thing is, we have to pick a medicine university that doesn't read the personal statement, because you can imagine if they read a personal statement as dentistry specific and you apply for medicine, they're going to be really confused. So we have to pick one that isn't going to read the personal statement. So for example, that's Plymouth Dentistry, then Plymouth Medicine, or Southampton Medicine. Well, Southampton does read the personal statement, but that's the one I applied to as a backup, and that's where I got accepted. So we can put a university's medicine as a backup choice. Cool. And then how much do you and Sara know about this application process? Do you know what the universities consider when you're applying to universities? Do you know what academics are needed to get accepted into these universities?
Yeah, I would imagine really good grades.
Exactly, yeah. So grades is a big one. Do you know about any entrance exams that are involved or not?
No, we're still looking into that.
Okay, cool. Yeah, so with the entrance exams, so the way the process starts is you start with the GCSE. So GCSE, considering she's in year 12, she's already done the GCSEs. And I believe you mentioned, what grades does she have for the GCSEs? Is it mainly 8s, grade 9s, or grade 7s? What does she mainly have?
Maybe 8s.
Mainly 8s. So mainly 8s. Does she have any grade 9? Maybe 1 or 2 grade 9s does she have in the science subject?
Yeah, she does.
Yeah, so mainly 8s, but then a few grade 9s is what we have. So mainly 8 to 9s at GCSE. And then the next step is the A-level. So for the A-levels, I'm going to assume she's doing chemistry, biology, maths, because that's the most common one people do. Is that what she's doing?
Yeah. Sure.
So that's literally the most common one people do. The other most common one is chem, bio, psychology. Do you know if the subjects actually matter for the third choice? Have you been told to pick maths, or Do you know if it makes a difference if it's math or psychology?
I think she's probably just doing maths for the sake of...
Fair enough. I mean, with some of the students that we've worked with, they've been told that you need maths, but that's not necessarily true. It's just a case where if you feel like she has the best chance of getting a grade A star, then that's a good option for her. But for the A-levels, the minimum grades you need is 3 A's. And then do you know if you want to apply for any of the London universities, like King's College, Queen Mary's, is that like one of the ones that you...
Yeah, I guess that's a better thing to have as an aspiration.
Yeah. Do you want to is it maybe because of location? Like, I know some parents, they don't want the child to move to a different city. Would you guys prefer to have her in London? So,
yeah, I mean, I would, but it's her choice.
Fair enough, yeah. I mean, if you would prefer to keep her in London, then in that case you need 1 A star and 2 A's. So for King's College and Queen Mary's, the grade requirement is slightly higher, so that's one thing to consider there. And then we talked about entrance exams. So the entrance exam to mention here would be the UCAT. So from A-levels, it's the UCAT. How much do you know about the UCAT? Have you heard about it before?
Of course, yeah.
So you've heard about it, okay. And do you know sort of when the exam is taken and how much preparation should normally be involved in that process?
No, I think you'll have to walk.
Okay, sure. So with the UCAT, the exam is sat anytime between July and September. It's very, very rare for someone to sit the exam in July. What we'd advise is end of August is the best time, because that's that sweet spot where you have enough time to revise for the exam, but you also don't go back into school in September not having done the UCAT, if that makes sense. So we would advise end of August is the best time to pick it. And then in terms of studying for it, it's very different compared to the A-level. So the UCAT is essentially, it's like an IQ test. Yeah. It's like an IQ test, so we would advise 2 to 3 months of studying for the exam. Do you know of any sort of support that she's getting from the school for the UCAT? Does she have any tutors maybe for the UCAT or no?
Yeah, I think she's opted for some.
She's opted for some, okay. Yeah. So with the UCAT side of things, the main things that I would emphasize is it's less so about the actual amount of revision that you're doing. Of course, the amount of revision you do is important, but the strategy is very important. So you have to actually know how to approach these questions, but we'll go into that in more detail. So let's go back to that timeline. So you guys are in year 12 now. So you've done the GCSE. Next after GCSE is the A-level. Then it's the UCAT. And then from there, it's the personal statement. And then it's the interviews. And we go from there. Yeah. So with the A-level side of things, what predicted grades is she currently working on? Are they straight A's, or have they been a mixture of like A's and B's throughout the year?
Been a mix.
Been a mix, okay. Out of chemistry, biology and maths, is there one that she gets a higher grade in compared to the other, would you say?
Chemistry.
Chemistry. So chemistry, does she get a lower grade compared to the other two?
Yeah.
Yeah, okay. And so chemistry, I'm assuming in your school they do a mixture of topic tests throughout the year. Is that the case? Do they get assessed on every topic?
Yeah.
Okay. So does she get more B's or more A's? Like just off the top of your head, like does she get more B's or A's, would you say?
There's some B's. I mean, there are good A's as well.
Yeah, but it just depends on the topic that comes up, right? Yeah. Fair enough. Okay. So one thing I really emphasize here is sort of the difference between a topic test versus the actual exam, right? Because the problem is, right, most schools, they do topic tests, but the issue with this is, and this is obvious, but it only assesses one topic. The real exam is going to assess 5 to 7 plus topics. So Sara needs to make sure that she's in a position that she understands the different topics very, very well, compared to just understanding one topic. Because let's say she gets a grade A star prediction here, that might make you feel good, and that might make Sara feel confident, but the problem is that might not be an accurate representation. When she has a full 2-hour exam, this exam might be 45 minutes, she has a full 2-hour exam here and she only gets grade C, right? Because some of the other topics aren't as strong. So the important thing to emphasize with this is we need to make sure we're doing as many past papers as possible. So as many full mock exam papers compared to just questions by topic. Yeah, so that's one thing for the A-levels that we can do to make sure she's getting the best grades possible. Next question I have is, how many hours per day is she studying on average? Like rough range, do you know how many hours she's studying when she comes home from school?
4
hours, really? Okay, so she definitely doesn't have a hard work problem. She's definitely working hard. What that sounds like to me is it's a strategy thing where we need to look at what's being done during that 4 hours and what is the grade improvements there. To give you some reassurance, you're not the only parent that I've spoken to that has a child that's studying like 3-4 hours a day and they're not getting consistent A stars. And again, that just comes down to what's being done during that time. Yeah. So with that 3-4 hours studying a day, is she mainly is it safe to assume that she spends a lot of time doing textbook and rereading the textbook and things like that? Or would you say like she does a lot more exam questions? What do you think she does more of?
I think it's a mix. I'm sure it's a mix.
It's a mix, okay. Fair enough. And do you know sort of in terms of subjects, how is she balancing things between 3 subjects? Does she have her own timetable, or does she just sort of, is it based on feel of which subject she wants to focus on?
I mean, I'm assuming there's a plan.
Okay.
But there's also times when it's
improvised.
Like, yeah.
Fair enough. So it's a case where like it hasn't really been a case where you've had a conversation about like what her plan is on a day-to-day basis and where that time is, if that makes sense. Fine. So this is something here. I mean, this is for all of the application process, but something I'd emphasize more for the A-levels, because the UCAT, it's only about 2 months, right? And same with the interview. This is only a couple of weeks of the personal statement. This is the only part of the process where you're going to be studying for about 16 months. So we need to make sure that the weekly timetable is very, very clear. So what should that timetable look like? For the timetable, if I was to give you a rough range of what this would look like. So let's say she goes home at like 5 p.m. Is that about right? So 5 p.m. So let's say she takes a 1 hour break at 5 p.m. You know, to eat, to rest up and whatever she needs to do. Yeah. 6 p.m. she starts her studying. The important thing is, what does she actually do during that studying? So here's where we'd recommend active recall. You mentioned that a lot of the time is being spent on textbooks. The really important thing to emphasize here, active recall is going to be important. So with active recall, things that we would recommend is flashcards. So have you heard of the software Anki before or no? No, so we'll get you set up with this after, but Anki is a software that Sara can use to make sure that she's doing active recall on the difficult topics that she doesn't understand. Next thing that we can recommend here is exam questions. So we need to be making sure that she's testing herself as regularly as possible, not just on one topic, but as many past papers as possible. And then some students will have the concern that they will run out of paper. So do you know how many like full mock exams she's done? There's about, 40, 50 plus for each subject. How many do you think she's done this part in the year?
Maybe around like 15.
15, okay. That's a good amount. In terms of how we can push that up is there's no reason why she can't do all of them, right? Because ideally you want to get into the exam on exam day having done every single past paper, but also doing the alt specification papers as well, right? Does she do the AQA exam board, or is it the OCRA exam board for science?
I think the AQA.
AQA, yeah. So AQA, I did AQA personally, and I can tell you that for chemistry AQA, there are lots of questions that are recycled from the alt specification. So alt specification is something that we'd really recommend she starts to visit once she's done all the papers. So 6 p.m. is active recall, and that could be done for about 2 hours until 8 p.m., right? 8 p.m. we can go for the second break, where she can take a short break before she comes back again. And then 9 p.m. we can do sort of one last study session. Here we'd recommend full mock exams. Yeah. So if it's UCAT season, that can be a UCAT exam. If it's A-level season, then that can be a A-level paper as well. So either UCAT papers or A-level papers. And as mentioned, we want to be aiming for 20 plus A-level papers, same with the UCAT as well. So at least 20 plus UCAT papers. So if I give you an example, one of the students that we worked with on the program last year, his name was Zaid. He scored top 1% in the country. I think it was 2,440 is what he got. And with him, there's no coincidence that he did 20, 25 plus mock exams, right? Whereas when we have meetings with some parents and their student has only got like a 1,500 UCAT score, they've only done maybe like two or three mock exams. And there's a clear correlation between the two. So as many mock papers as possible, and then she can pretty much call it a day at 10 p.m. ready for the next day. So that's what we'd advise as a rough timetable. Do you feel like that will help her get on track to make sure that that chemistry grade can go from a grade B to a grade A star? Do you feel like this will help her get to that position? Yeah? Cool. I think so too. I reckon if she can start implementing this stuff regularly, it should get her to that grade A star in no time. Yeah. Okay, Sami. So how much do you and Sara know about the UCAT exam?
Very little. She knows like there's some kind of aptitude test. So I think we can help with more information here.
Fair enough. So I'll break it down for you. So for the UCAT, it's an aptitude test, that is true. And the exam is sat between July and September. Do you know what score it's out of? Or no?
No, I wouldn't know actually.
Fine. So the score, it's out of 2,700, okay? And there's 3 sections. So the sections are verbal reasoning, decision making, and QR, or quantitative reasoning. So QR is self-explanatory. It's maths, it's GCSE level maths. The difficulty is you only have like 20 seconds per question. Verbal reasoning is speed reading and reading comprehension. Decision making is probability, logic, Venn diagrams, things like that. Yeah. So each section is out of 900 points. 900 points and 900 points. To put this into context for you, the highest ever score was someone that only lost about 10 points, right? No one's ever got full marks, right? And no one really will, or maybe one day someone will get full marks, but it's never happened in the past 10, 15 years, right? What score should you be aiming for? So a top 10% score is 2,220. If she gets 2,220, she can apply to almost every university, okay? Worst case, if she gets around 2,000, 2,100, she can apply to some universities and she still has a good chance. So these are the scores that we should be aiming for, okay? So do you know how many people sit the UCAT exam every year? No? So typically it's about 40,000 people, yeah? Do you want to take a guess how many that was in 2019? So how many do you think it would have been 6 years ago?
Maybe a couple of thousand lesser.
Close, but it's 10,000 less. It was less than 30,000 in 2019 and now it's over 40,000. So there's 10,000 more applicants that Sara's going to be competing against, right? It's tough, but that just means that these scoring deciles and the scores that you need is going to increase every year. So that's what we should be aiming for. So do you have a plan in place for Sara's UCAT revision currently?
So she's planning to start over the summer. She's getting some online question banks and take it from there.
Fair enough. So online question banks, there's two that most people go for, either Dentistry or Medify. By far, these are the two most common. Pretty much every year we get questions about which one should I use. Short answer is it doesn't matter, right? There's people that have scored top 1% in the country using Dentistry, and there's people that have scored top 1% in the country using Medify. It really doesn't matter which one you use. It's more about what you actually do in leading up to the exam and how much practice you do overall, okay? For the UCAT side of things, one thing that we will really emphasize is the strategy. The strategy is very important because if I explain to you what the questions are like, so if I say, this is the UCAT screen, here, let's say this is the passage, you have your writing, and then here is the question, and then you have 4 answer options, A, B, C, D. These are the 4 options. Yeah, let's say that's the UCAT question. The thing is, in the A-level exam, that's not how it works, right? In the A-level exam for science subjects, most of them won't be multiple choice. There'll be written answers. You learn the content, you memorize the content, and you learn how to apply it to the question, and you get the answer correct. The UCAT is not like that. The UCAT, every question will be multiple choice, which might make you think it's easier, but it's actually a lot harder, right? Because with the A-levels, it's very easy to study for. You just learn the content, you do the exam questions, it's the same thing every year. The UCAT is very hard because you actually have to learn the skills and the techniques. So with the reading, does she read like a lot of books when she was younger or yeah? Okay. So that will help her with the verbal reasoning. So verbal reasoning is the lowest scoring section every single year. Because she's read a lot more books when she was younger, she'll be able to answer these questions a bit better. What about her math skills? I know she mentioned that she's picked A-level maths, but how confident would you say she's like mental maths and arithmetic? Do you feel like she's done much of that practice or not?
Maybe that's her weak side.
Yeah. So if maths is the weak side, then that's definitely something that we want to work with. It's definitely something that we want to work on because that's a big part of the UCAT as well. So your mental maths as well, because that's in both sections, decision making and quantitative reasoning as well. So to put that into perspective for you, so you need to learn the skill of, okay, how can she actually answer these questions in the time conditions and not just memorize them, if that makes sense. Because with the A-level, you can somewhat get away with memorizing the content and the marking points. You can't get away with it with the UCAT. You actually have to know how to read very, very quickly, how to spot the answers, and how to pick out the correct answer from the questions, if that makes sense. Yeah. So that's the UCAT side of things. And then do you know about strategic applications? Do you know sort of which universities are the best based on the different UCAT scores and things like that? No? Okay. This is a big thing. I mean, does your school have like a career, the Sara school, do they have like a careers advisor?
Yeah.
They do? Okay. Yeah. And have they actually applied? I'm assuming they haven't, right? Because they wouldn't be teaching if they're a dentist, but I'm assuming they haven't actually applied to dentistry themselves. Is that correct? Fair. And I'm assuming like they help all the other students in the school, not just the medicine dentistry people, right?
Of course.
Yeah, okay, fine. So with that, I mean, again, no disrespect to Sara's school. Of course, I'm sure that they have great intention and they're trying their best, but the thing is they've never actually applied to dentistry before. So they may have helped like 1 or 2 students in like 10 years ago in the past with medicine dentistry, but they don't actually know inside out what are the different universities, what are they looking for, what are the acceptance criteria. This is something that you guys really need to do your research on, right? And today I'll give you like a quick rundown, but what I'd recommend is like take your time to sort of look through more in-depth research. So I can send you like a document that outlines everything for you, but university selection is very important. The universities, they filter you out. So let's say this is the filter, right? At the top, they filter you on the A-levels. So you need 3 grade A's. That's the first filter. The problem is maybe I'd say like 60% of people, they don't even pass this first stage, right? So many of the families that come to us, similar to your situation, so you said Sara has a grade B in chemistry, right? If Sara's grade B in chemistry doesn't get to a grade A or A star, what would happen in terms of this first filter? Would she pass it or not? She wouldn't pass it. Exactly, right? So that's the problem. It's like we can talk about UCAT and we can talk about interviews and I can go through all of these things with you, but if first things first, if we don't fix that grade B in chemistry, nothing else matters. So this is number one priority. So 60% of parents, probably more, don't even meet this first criteria. So first criteria is the A-levels. Next is going to be the UCAT. On top of this, actually, there's the GCSEs as well, but in Sara's case, she's passed those. She's got good grades. Normally, we need 7s and 8s, which she has. She has 7, 8, and 9s, so that's fine. After that, we have the UCAT as well. So with the UCAT score, it depends where you apply to, okay? So to put into perspective for you, Bristol and Newcastle, they're the high UCAT universities. King's is also high UCAT. Manchester, these are also high UCATs. There's no such thing as a low UCAT university. For medicine, some of them are. For dentistry, not really. Okay, so there's no really sort of low UCAT university. The safer options, though, as a general rule of thumb, the ones that are outside London and sort of outside of England, so such as Dundee, Cardiff, these universities, Belfast, these universities that are outside of England and there are other countries, still in the UK, those are safer UCAT scores. Right? So if you have a lower UCAT score, that's a backup. But I'm assuming in your case, moving Sara to Belfast wouldn't be the ideal situation, is that right? Yeah, it's not, right. So that's why they have like that's why that can be our backup option. So as a backup option, we can put those options. In general, however, top 20% in the country, top 10%, you should be okay. Yeah, so we're looking for top 10% ideally. Yeah. Then the next filter is the interviews. So there's a reason I didn't put the personal statement on here. How much do you know about the personal statement? Do you know sort of what things you should be focusing on, what stuff makes a personal statement stand out? Has school sort of had a conversation about you about what to make you stand out for the personal statement?
Yeah, I mean, it's supposed to be true to what she really wants and what she's looking for in life, I guess.
Yeah, exactly, bang on. So it needs to be personal, right? And that's the thing, most of the ones that we read, it sounds obvious, but it's not personal. Most of the ones that we read, they're very generic, they're very cookie cutter. It's the same generic statements about wanting to help people and being passionate about the science, but they don't really go into enough detail about what's specific about their situation that makes them want to become a doctor or dentist. So that's the thing with the personal statement, but that's not the make or break with the application. These things are the make or break with the application. So lastly, with the interviews, do you know if when they get to the interview stage, do you think that they consider any of the other stages before this? What do you think?
Maybe they do. Yeah, just a little.
They don't. So that's the thing. So again, this is why we do what we do, right? Because most people don't know this stuff, and there's nothing against you, right? But just most people don't know this stuff. But once you get to the interview stage, they don't look at your UCAT score. They don't look at your GCSEs. They don't look at your A-level. Once you get here, they know you passed this stuff. All they care about is how good are you at this stage? Yeah. Can you answer the questions correctly? Are you able to demonstrate professionalism and good communication skills? And can you answer ethical scenarios? If you can do these skills, you can pass the interview and you'll be fine. Do you know roughly, do you want to take a guess what the rough interview percentage acceptance rate is for medicine and dentistry? Do you know what the percentage is roughly?
Maybe 20%.
20%, that's close. So depends where you apply to. Some universities are 30 to 40%, but there are some which are as low as 13%. So I believe we had one student that applied to, I believe it was Dundee, that had a 13% post-interview acceptance rate, and they ended up getting an offer. So some universities, it's still only 10% of people pass this filter, others about 30, 40, 50%, okay? So you've got to imagine you put all this hard work in for 2 years, you do well in the GCSEs, well in the A-levels, well in the UCAT, and then you get to the interview stage, nothing else matters after that, okay? And the same way that the A-levels have marks and the UCAT has marks, the interview also has a pass mark. So you have to pass the pass mark as well, okay? Once you pass this filter, then at the end is the offers. The offers for dentistry is what waits at the end, or the offers for medicine is what waits at the end for you guys. It's a tough filter, it's a tough process to follow, but as long as you can actually have the best guidance at each part of these processes, make sure you meet the minimum thresholds, then you should be okay, yeah? Cool. So, Sami, do you know roughly like what percentage of students get offers for dentistry? Like normally how many people apply, how many get accepted? Do you know roughly what the percentage would be?
I would like to assume it's like around 25. 25%,
okay. It's a lot lower. So if I give you some examples, right? So normally the acceptance rate is between 10% to 15%. Right, so let me put that into perspective for you. So for King's College, if I put you the example of King's College, they have 1,300 applications for only 1,120 offers roughly. So that's about 10% to 11% acceptance rate. So to put that into perspective, imagine there's 9 people lined up, right? Only one of these people is going to get an offer, right? So you need to make sure that your daughter's in a position where she is more capable than every single one of these other students to be able to get an offer, right? And she's not just competing with the people in her classroom, but she's also competing against all of the other students in the country, right? So it's a very difficult process, but the best thing that we can do is make sure that she has the clear plan laid out for her. So to help you guys as much as possible, number one things that we need to focus on right now. So right now, chemistry grade is a grade B. We need to get that up to a grade A star. How do we do that? She needs to be doing more past papers. She needs to be implementing more active recall. And she needs to be looking at the old specification questions. Do this stuff for me. Get back to me in 2 months' time. If she's not a grade A or A star, then we can reassess from there. But I'm confident that if she does the stuff 5 days a week, she has 2 days off for rest, she does the stuff 5 days a week, 4 hours a day, there's no reason why she can't get a grade A star. Okay, so that's the main focus there. Once she's done that, then the next focus is the UCAT. So the UCAT, make sure you guys, so we've got about 3 months until the exam. By the end of this month, make sure to start preparation. Okay, so UCAT at the end of this month. Yeah, Medify, you can get med entry, it doesn't matter. Make sure that you have a correct question bank ready, and you're doing, do you remember how many mock exams I told you that she should be doing?
Yeah, 20.
20? Yeah, so at least 20 plus mock exams. Yeah, aim for 20 plus mock exams. Make sure that she's looking at the feedback, she's reviewing where she's gone wrong, and sort of making the corrections there. Okay, and then lastly is the interviews. So interviews, as many mock practices as possible. Yeah, so mock interviews as many as possible. Do you guys have any like doctors or dentists in the family, or is this the first time for Sara?
First time, yeah.
First time, yeah. And is she your eldest child, or have you had like other children that have applied for university before? Only child, okay, fine. So obviously for you guys, it's a very new process, which is understandable. But what I'd recommend for the interviews is to do as much practice with people who aren't friends and family, because the problem is if she practices with you, she's very used to speaking with you all day, every day, and that makes things pretty easy. Whereas if she's practicing with someone like myself, she may not have met before, may not have spoken to, it makes things a lot more difficult because you have the exam pressure. So those are the things I'd emphasize on. It's a hard process. You know, normally it's about 10% acceptance rate. Do this stuff, get the grade to a grade A star, focus on the UCAT, focus on the interviews as well. Hopefully she can get accepted. Yeah. How do you feel? Based on what I've said, do you feel like this will help you?
Yeah, I feel like it's been very helpful, and also it's been thought out and planned for me, which is a big thing. And I'm sure if I take this to her, she would know better how to apply it.
Sure.
And I think that's what this is all about, right? It's about going down the right path.
Exactly. No worries, man. Hope this is valuable. And then if you need anything else on top of this, just let me know. But I'm hoping that in a year's time, you drop me a message and she's got accepted for dentistry or medicine, whichever one she picks. Yeah? Awesome, man. No worries. Best of luck. Best of luck. Take care. See you.